Okay, so this is video number 2, and in this video I'm going to explain my issue of what's going on with my heart. So, 2 years ago I was diagnosed with mitral valve regurgitation, and it was mild to moderate, and I didn't have any horrible symptoms at that time. I was just getting short of breath now and then, um, but why they did the echocardiogram was they were actually looking to see if I had a genetic disorder that my son was diagnosed with, Marfan syndrome, and they wanted to see if I had a dilated aortic root, which would be, here's the picture of the heart, and this is the aortic root. I think this is the ascending aorta. Don't quote me on that, but my son's is dilated and larger and has thin walls, and he's at risk of having a rupture. So they're looking at him and keeping track of him, and he's good right now. Over 2 years, it hasn't gotten worse, so hopefully, fingers crossed, he won't need the surgery. It'll just stay as it is with the restrictions he's on. And I'm gonna have another surgery or another video explaining Marfan's and how he was diagnosed. But this video is about me and what I have going on. So let me take a drink and take a rest because I'm getting out of breath just talking. So 2 years ago, what was going on with my valve was, here's the mitral valve, and I have a leak here. So when your heart pumps, it pushes blood through here, and then your heart will pump again and push blood out of your left ventricle through the aortic valve. What's happening is my heart pumps blood here, and then when it pumps again, I have some blood going forward, but because I have this leak, when this pumps, it's also pushing not only forward, but I'm getting some blood going backward. So that's what the regurgitation is. Some goes backwards. So as of 2 years ago, that was my diagnosis. So what they were going to do was just monitor that, because I wasn't really having any horrible symptoms. What I was having two years ago was I was getting a little out of breath, but I didn't know it was connected to this. What I remember happening specifically was, I'm a wedding photographer, and I would carry my camera gear, and I live on the Jersey Shore, so a lot of my weddings are on the beach, and or people want pictures on the beach. So walking through the sand is more difficult than walking on a sidewalk, but it shouldn't be to the point where I get out of breath for what I was doing. It wasn't like I was running. I was just holding my camera, which I have a professional camera. It's probably, I don't know, I could look it up to be sure, but my camera was probably about 10 pounds with the lens and the flash, under 10 pounds. And then I would have my camera bag. Sometimes it would have another camera body or more lenses, spare batteries. So carrying this stuff, again, probably about 20 pounds of stuff, and trying to walk, I would get out of breath. I would get winded. I could feel my heart racing. I would sweat, and I wouldn't get dizzy or anything. But I was struggling, and I just thought, well, maybe I'm just getting older. And my husband at the time that was with me one day said, wow, you really need to get to the gym if this exertion is bothering you that much that you're getting out of breath. So I just thought it was like maybe I'm getting older, maybe I do need to exercise more. It really wasn't to the point where I was worried about it. And I didn't know that the regurgitation was what was causing this. Now, in hindsight, I do know that's what was going on. So let's move forward to my heart getting worse. Let me see, maybe it was about a year ago, I'm going to guess. Oh, I could tell you when it was because I have my echocardiogram report. okay, so in 2013, October of 2013, I what was going on with me was I decided to join a gym because I wanted to get healthier. I was also running. When I would run, I would get a little out of breath. This might be um, let's say this was like before the beginning of 2013. My I would get out of breath and I thought it was lung issues. My sister has exercise induced asthma and some COPD issues. So I thought, oh, maybe that's my issue. Maybe I'm exerting and I have some kind of exercise induced asthma or something. So I went to a pulmonologist at that time, and he thought, yeah, when I'm exerting, I am getting short of breath. So he put me on an inhaler. It was albuterol that he wanted me to use before I would exercise. And it wasn't just exercising. It was when I would sing. I play ukulele, I play flute, and I sing. So even conversations, when I would talk, I'd find myself like, okay, I got to stop and take a breath. Like I'm running out of air. When I would sing, same thing. When I would play my flute, same thing. I would run out of air. Sometimes I'd even get dizzy playing my flute. So I started using this inhaler before these activities, and sure enough, it helped. I wasn't getting out of breath um, when I would sing or when I would play my flute, as long as I did this inhaler. Um, so that was, I'd say, the beginning of 2013. And then October 2013 is when I realized that it was a heart issue, my shortness of breath. And how I found that out, what was happening was I went to a gym and I would use the treadmill and I could feel my heart, you know, I thought I was getting a good workout. I'd work my heart doing cardio, and then I didn't know anything was wrong. And then I switched, after a couple weeks, I switched to try out this elliptical machine. So the elliptical machine had a chart on it saying what my pulse should be. And for my height and weight, I am, maybe I should have put this in the intro video, I'm 5'8", and at the time I think I was 140 pounds. So for my height and weight and age, I'm 44. I was 42, 43 at the time. It said my cardio pulse during exercise, during cardio, my pulse should be 120. So when I get my cardio's up, I feel my heart going. So I decide to take my pulse and see where it's at to see if I'm at the right cardio pulse level. So it should be 120. So I'm taking my pulse and it's saying during exercise, it's 188. So I'm like, oof, that probably shouldn't be that high. Let me call my cardiologist to make an appointment. So I called my cardiologist to make an appointment. When I went to see him, he found they did a EKG. They always do it every visit, and the EKG checks for past heart attacks. I didn't have any. And he did my pulse at rest in his office, and it was about 120 at rest, between 110 and 120 at rest. And he said, yeah, it probably shouldn't be that high. Let's put you on a Holter monitor to check and see how fast it is. So he said, do what you normally do. So I had the 24-hour Holter monitor on. And when I went to the gym and it did, yeah, my pulse was 180 again. I went back to him to go over the report. And he said, yes, your heart is overworking. It's, your pulse is 180. This is not okay. We need to see why it's so fast and go from there. So that week he did an echocardiogram, and what the echocardiogram showed was what I explained in this. It's the valve, it's leaking, so I have my heart's pumping and it's leaking backwards, And what's happening is my heart is like, oh, you know, there's not enough blood going forward, so it needs to beat faster. It's overworking to try to get enough blood forward. So because I have the regurgitation, what's also happening is it's pumping, and it's pumping fast. So now where I was having some regurgitation, I'm having even more regurgitation because it's pumping quicker. So I'm getting more blood backwards. And at this point, it's going into my pulmonary vein. And that's what's making me short of breath. And that's why the heart's pumping fast. So at this point, he put me on a drug called Natadol on 20 milligrams. I take it each night, and taking that drug has slowed my heart down, so it's not overworking. So now then 2 years back in 2013, my regurgitation was mild to moderate, and he put me on Adderall to slow my heart rate. So then once I was on that, my pulse went down to a normal rate of about 70 at rest, and I could exercise, and my exercise pulse was 120. So he wanted me to exercise, and now on the Natadol, I could exercise without my heart overworking. So I'll stop this video here, and because it's just getting long. I'm at 11 minutes now. So I'm going to put the next video link here, and this will explain where my heart is now, and why I needed to go back for another echo now in 2016. Let me see. Well, I'll make the link. So watch my next video. Thanks.